You know that 50% of the men have their prostate enlarged by the time they make 60 years. In fact, around a third of the men have their prostate enlarged by the time they make 50 years. Therefore, if you're a man in the age of 40, 45, and you've not done a checkup for prostate enlargement and the prostate cancer, you could be at a risk because you don't know. This video is for you, just to let you know some of the things you need to know when it comes to prostate enlargement. If you want to know about prostate cancer, we shall be uploading a video very soon about prostate cancer. But for this video, we shall focus on prostate enlargement, and we're going to look at some of the things that you have to look out for in terms of symptoms for you to know that you could be having prostate enlargement, and what you should do in case you notice those symptoms, but also what you can do to prevent this condition. We actually need to realize that prostate enlargement is part of the normal aging process among men. We expect that as a man grows in age, one of the things that are going to set in is prostate enlargement. Prostate enlargement is actually largely testosterone dependent. However, you know testosterone is a male sex hormone, and as a man is starting to age, this hormone goes down. And therefore, there are actually other factors that could contribute to this enlargement. Things like metabolic syndrome. So if you're a man who is maybe obese or is having things like diabetes, hypertension, those chronic illnesses, you're actually at a risk of developing prostate enlargement. This also comes with things like hyperinsulinemia and many other factors that can come in. Let me save you the science. So we need to understand what is a prostate and what is its function or its purpose in our body. So just as you're seeing in that picture, the prostate gland is just a small gland or a small organ that is located, or it's part of your reproductive system as a man. So it is located just adjacent to the urinary bladder at the apex, but also it encircles or it surrounds the urethra, which is the tube that carries the urine from the urinary bladder to join the ureters from the testicles for them to be able to form the urethra that comes out at the penis. And its work is mainly to produce what we call the prostatic fluid, that fluid that comes to join other fluids from other glands like seminal vesicles, but also the sperms from the testicles to form what we call semen. So semen is made up of 70% fluid from the prostate. That's how important it is. And this fluid that comes from the prostate, first of all, it is alkaline in the pH. So it is going to provide protection to these sperms when they reach into the vagina, because the vagina is acidic in pH. So this alkaline semen is going to neutralize the acidic pH in the vagina to enable the sperms to actually survive in there. But in addition to that, it also provides nutrition to these sperms as well as lubrication. So a prostate is actually very, very important on a man's reproductive system. But what happens if this prostate gets enlarged? Now, from the anatomy that I've told you, when you look at that picture once again, this prostate actually surrounds the urethra. So the urethra is this tube that carries urine from the urinary bladder. So when this prostate enlarges, it is going to cause some bit of obstruction at the urinary bladder or at the apex of urinary bladder and the urethra. Okay, so this is going to cause some bit of obstruction to the urinary flow as urine is being eliminated as the person is actually urinating. So most of the symptoms that are going to come through will come in from this process of obstruction, and you realize that most of the symptoms you're going to see are actually related to the urinary system. Okay, and they include the following. So one is urinary frequency. If you're someone who has noticed that you're actually urinating very many times in a day, it could mean that you're having maybe incomplete bladder emptying. This incomplete bladder emptying comes in whereby if there is obstruction, when you go to urinate, all the urine will not come out. So when it doesn't come out, this bladder fills up very fast, and this is going to cause the bladder to contract again. You're going to have the urge. So urgency or feeling that urge to go back and urinate is also another symptom you're going to look at. And as this process continues, it is actually going to weaken the muscles of the urinary bladder. So you won't actually be able to, the bladder won't be actually able to fully contract for you to be able to actually expel this urine. So another symptom you're going to notice is nocturia. So you've been fine, but all of a sudden you notice you're starting to wake up very many times to go and urinate. It could mean that your prostate is enlarged and you might need to do a check. There is hesitance, so you go to urinate, but you have to actually push so hard for the urine to come out, or for you to actually initiate a urine stream and maintain it. But also another symptom you could look at is straining, whereby for you to be able to maintain a stream of urine, you actually do strain. You have to push it harder. And if you do not push harder, you get what we call dribbling, whereby you release only a very small amount of urine, so most of it remains inside. And most times people who are actually having this condition, they even tend to wet their pants, because as they are pushing the urine, just a little of it comes out, and it starts dripping, hence wetting their pants. Of course, like I said, most of the symptoms are urinary symptoms. And I wanted to first give you those ones because they are the first symptoms that you will see before you actually determine if your prostate is enlarged. And they'll give you a warning. So in case you're someone who has noticed some of those symptoms, you might need to look out for a doctor to do some bit of checkups, which will include the following. The first one is what we call a digital rectal exam. So in this procedure, the doctor is going to use his hands. So one of the fingers is going to be gently inserted through your anus into your rectum. And then just because of its anatomy, this prostate is adjacent to the rectum, the doctor will be able to examine this prostate. So he's going to examine its size. He's going to look out for the margins. He's going to look out for the groove or the contours on the gland. But it's also going to look out for any nodules or nodular masses on that prostate, which could indicate maybe presence of a malignancy. There are other tests that we can do. We have ultrasound scans that can be done. We can do a transabdominal scan, or we can do a transrectal scan, where the probe is also inserted into your anus and then up to your rectum, and comprehensively examine the prostate gland. But also there are other lab tests that we can do, and starting from the most common one, which is a urinalysis. So just because of this process I've told you and the incomplete bladder emptying, people with this condition are prone to having recurrent urinary tract infections, or what we call UTIs. But also UTIs can present with some of the symptoms that we've talked about in prostate enlargement. So you want to do these tests all together. You want to do the rectal exam together. You want to do the ultrasound together with a urinalysis. It's going to help you in case there's any UTI, you will be able to manage it. And sometimes, in case you're in settings that can allow you, you might need to do maybe a urine culture and sensitivity so that you do targeted treatment. Another test that we do is what we call the prostate-specific antigen. So this antigen, or this hormone, is actually raised in blood when there is any problem that is affecting the prostate. So in benign conditions of the prostate, or conditions that are non-cancerous, we might have a rise in this PSA, or the prostate-specific antigen, things like urinary tract infection, infections of the prostate, or what we call the prostatitis, or even trauma. It could cause a rise in the PSA. However, in cases where we suspect someone to be having cancer, we shall find a very high PSA of more than 10 nanograms per deciliter. And this could communicate presence of maybe a prostate cancer, which will now probe us to do further investigations, perhaps looking into the biopsy, where we take off a sample, examine it microscopically, and be able to identify if there is actually cancer or not. Other tests that we do are also supportive. We can do serum electrolytes. They are very important because in case there is this condition, sometimes we have what we call hydronephrosis, whereby the urine that is being retained in the bladder can flow back into the kidneys and end up causing kidney injury. So together we shall also do it with other renal function tests like maybe creatinine and the urea or blood urea nitrogen to help us see if the kidneys are functioning normally. Management for prostate enlargement is both medical and surgical, depending on how big the prostate is, the symptoms associated with it, and any other complications, but also risk for prostate cancer. So we have medical treatments that we could use. They are tablets you can swallow. They are going to help in two ways. One, they can help to control the symptoms that you're experiencing, the urinary symptoms, but also it can help to actually reduce on the size of this prostate which is enlarging. However, if the prostate is very big, we might need to do a surgical removal of the prostate, and this is basically done especially in men who have reached the age where the reproductive function is no longer desired. So we do the surgery so that we improve their quality of life. Then we have also where we suspect maybe malignancy. If we've taken off a sample of your prostate, I've done histology and we found that maybe there is a malignancy, there you might need to be put on now the alternative treatment for cancer, things like radiotherapy, chemotherapy, among others. However, we also have some minimal invasive treatment options that are available, which I might not be able to illustrate or to elaborate in this video, but you can look them up. But the advice is, please, in case you notice some of these symptoms, run to the health facility, run to a doctor, get a quick checkup, and make sure that you do not have a prostate enlargement. If it's enlarged, you can be started on treatment before things worsen. Thank you very much for watching. I hope you've learned something from this video, and I hope you take a step to go and do routine screening. Doesn't matter whether you're having symptoms or not, routine screening is recommended for any man who has hit the age of 40 when it comes to issues to do with the prostate, especially the Black and African men. Thank you very much. See you in our next video. Like I said, we shall have a video made or done on prostate cancer, so that it will be a part 2 or continuation of this video. Thank you very much. I love you. Please subscribe, like, comment, and share with your friends. Bye-bye.